Hi, welcome to another Ethos podcast. I'm Ivan, the editor-in-chief of Ethos. I'm in Atlanta here with Professor Keiji Fukuda. He has held many notable positions, including the chief of epidemiology at the Influenza branch at the US CDC, assistant director general of the health security at the World Health Organization, and the director of school public health at the University of Hong Kong. I'm very honored to be joined by him here today. Well, thank you. How are you doing?
Great.
So I just want to start with the question on uh, the conference that you chaired on pandemic preparedness in 2018, attended by many directors of major health institutions in the US and abroad. Do you have any afterthoughts since COVID has ended? What went right? Were the predictions accurate?
So I think that COVID really stands out among the outbreaks, notable outbreaks and pandemics in our time. And, there are a couple reasons for that. One of them is that the sheer scope of it, I think, has been amazing, in terms of people getting sick, numbers of people dying, but also I think in terms of how much it's impacted mental health around the world and how much it has, affected social patterns, going to school, going to work. It's changed how people go to work. And I think there's, a group of students that are still catching up from the impact of COVID. So I think all of that's been pretty surprising. I think that before COVID, we had anticipated that another pandemic would come. I think that we knew that we didn't know what would cause it. But I think that the overall impact of it really has taken everybody by surprise. There were some good things that we saw that happened with it, but there are also some uh, things that we could have done much, much better.
Yeah, it was a great timing that it was in 2018. COVID, soon happened afterwards. But do we normally need a crisis to facilitate preparation, or can we prepare for future crises without, without incurring a great cost?
Well, Ivan, I think that if we can't prepare without a crisis, we're in a lot of trouble. I mean, basically, when a crisis happens, we respond to the crisis however we can. And I think the world and countries can do a lot of things during that. But the nature of preparations is when you're not having a crisis, you really take the time to strengthen yourself where you need to be strengthened. And this means things like decision making, the kinds of health systems that we have out there, how we get information out to people and minimize misinformation, how we make sure that we are sharing the countermeasures around the world. I think that one of the things which stands out for me for every outbreak I've ever worked on is that we often don't get vaccines to people in a sort of more fair way. And so I think there's a lot of things we can do better, but we shouldn't rely on the crisis to get them done because we need more time than the crisis is going to last.
Having the crisis already happened, do you think we can rely on it to institutionalize change that can be sustained and relied upon in the far future?
I don't think the crisis by itself is enough. After every big crisis that we've had, people start forgetting about the crisis. People want to move on. Uh, Governments don't want to linger on what's happened in the past. Instead of relying on the crisis, I think what we really need to rely upon is a quite serious and sober discussion and understanding that something like COVID really sets the entire world back by years. And seeing that, I know we can do better. I know there's a lot of things that we can prepare. So I think it's remembering the crisis, but not relying upon it to get better. It's really more a matter of political will and of people who have the same idea in mind, sitting down and saying, let's get this done.
So you were also one of the four government advisors to the Hong Kong government during COVID-19. What was that job like?
Well, during COVID, when I was in Hong Kong, I was on a couple of different advisory committees to the Hong Kong government. Some of them were very scientific committees, really looking at what's the nature of the SARS-CoV-2 virus, for example. Some of it was looking at vaccines, what's the data which is available. And then some of it was working directly with the government on providing perspective And what the government was asking in that group, in that committee, was, can you give us the public health perspective information that we ought to know to make decisions? I think the government was pretty clear that, we have to take a lot of concerns together. How is the public feeling? What's the economic impact going on? What would closing borders or taking different actions mean? But we also want to very much make sure that we understand what's the scientific information, what's the public health information that we ought to be also taking into consideration to make good decisions. So it was really interesting. It was a quite serious endeavor, I think, on the part of the government to understand a lot of the main factors it should understand before deciding what to do.
So were policymakers responsive to the academic community by and large?
I was impressed, yes. I think that one of the outstanding things about Hong Kong's response, particularly when I look at responses in other countries, was that the government was very much aware that Hong Kong has an unusually rich scientific community, public health community, academic community. And I think that it really relied upon that group of people to provide input, provide information, provide perspective. So I think from that perspective, the government did a good job in terms of incorporating academic scientific input.
So I just wanted to move on to the topic of antimicrobial resistance. You were the special advisor to the Director General for Antimicrobial Resistance for the WHO. Could you expand a bit about the dangers of antimicrobial resistance, AMR?
Yeah, antimicrobial resistance, or AMR as it's frequently referred to, is a little bit like hypertension is in clinical medicine. In clinical medicine, people don't realize they have high blood pressure and then something really bad can happen. And in the same way, antimicrobial resistance is something that still very few people understand about. But basically what it means is that we're losing the ability to treat infections because the medicines used to treat the infections are becoming less effective. And that's because the different pathogens out there are genetically changing over time to become more resistant to the medicines. The implications of this are enormous. We rely upon antibiotics to treat infections. We rely upon them when we have large operations to protect people or when people are immunocompromised, but we also rely upon them for our food supply. It has a huge role to play in food security and food supply. So there has been some recent work done looking at the numbers of deaths from AMR. And so one of the really sobering projections coming out of that work is that by the year 2050, we can expect to see as many people dying from antimicrobial resistance as we can from cancer. That's around 10 million people per year. And so that's an enormous figure, and that's something which is developing as we speak. And so it's a very large problem, but it's a problem which is probably under-recognized by most governments.
Is our budget, our social paradigm, the way we budget for these diseases, is it reflecting the severity of AMR right now?
I think that we are not still fully recognizing the seriousness of AMR. We recognize it better than we did, say, 5 years ago and 10 years ago. But we have two really big issues right now. One of them is how do we make sure that we develop new antibiotics? So that's sort of one stream. But the other main stream is how do we take the antibiotics that we have and use them in a way which is least likely to contribute to more AMR. And so while in concept we see those things, we still don't really have the economic models to develop antibiotics, new antibiotics. We've seen some new antibiotics come online and fail economically, and this has been very sobering. On the other hand, we know that we still have a lot of practices in place in which antibiotics are used unwisely, and that is contributing to the growth of antimicrobial resistance. So this is partly a money issue. We're not putting money in, but I think it's more a priority issue. We get things done when we recognize something is really important. So that's whether that's economic issues or health issues. If, as a society, we say this is really critical for us to solve, then somehow we can apply a lot of things. So it's partly money, but it's really more prioritizing, is it that important of an issue?
Why are antibiotics economically unviable?
I think that developing antibiotics is notably difficult. It's not an easy thing to come up with a new class of antibiotics. It's an expensive process, and yet it's a funny medicine. Some medicines, once you develop it, you can really have a lot of people use it. The new medicines for diabetes, which people are using for weight control, it's probably an enormous market. But antibiotics are a little bit funny. We develop them, but we don't really want to use them because they're going to contribute to more antimicrobial resistance. And so we want to minimize the use of them, and yet we want to have a lot of them available in case we need them. So a bit of a strange market problem.
I just wanted to move into like the World Health Organization. So, but first off, if you could talk to the current Director General of the WHO and give him some advice or your insights, what would you say?
Well, one, Ivan, I'm not sure that I could tell the Director General anything that he hasn't already thought about a lot. But I think the outstanding issue in front of WHO right now is a very difficult issue. In the current political climate that we're in, where we have a lot of geopolitical tensions, the need for multilateral organizations to be trusted, to be effective, is really critical. And I think that's probably the single biggest issue in front of WHO right now. How is it going to remain the centerpiece of global health, which I think it needs to be? We need an organization that everybody can turn to, everybody can trust, that can help improve cooperation, improve coordination around the world. But doing that in an environment in which is, basically hostile to multilateral relationships is very difficult. I think that's the single biggest challenge for WHO right now. And that is the issue that I would want to talk with the Director General most about, and about what is the best way to go about ensuring that WHO can actually do the job we need it to do.
What will global health look like in a coming Trump presidency?
I think it's going to be more severely challenged. In the period up until now, the world has really needed the U.S. in a couple of different ways. One is simply that the U.S. puts a lot of money into global public health, and money is needed to carry out a number of initiatives. But the U.S. has also provided a huge amount of leadership, both in tackling different issues like smallpox in the past, polio more recently, but also in the wars against cancer, chronic diseases. And if President Trump withdraws U.S. support from global health, it's a very big problem. It really challenges us. But it's only one part of the overall picture in which the U.S. is critical for a lot of the multilateral relations and structures that we have in the world. So is it possible for other countries to step in and replace it? I think in the here and now, it's very difficult to see how that would occur. So I think that if President Trump carries through and then does not provide the support which I believe the world needs, I think it's going to be a more difficult period.
When you were working there, did you feel like you were more of a politician rather than a physician?
The WHO is a unique health organization in the world. You know, it's partly a technical organization, so it draws upon experts around the world, and a number of the people in the world are technical experts. You know, they're physicians, they're statisticians, they're anthropologists, they're nurses, they're communicators, and they know their work really well. But it's also inherently a diplomatic and political organization. I mean, virtually every country in the world belongs to it, and WHO's job is to take all of those different countries and entities and really get them to work together. At the end of the day, that requires a lot of political skills. It requires a lot of diplomatic skills. It requires coming up with approaches which are not scientific. And so it's both very much. You know, so we rely upon WHO for providing global expertise, but we also depend on it to provide political and diplomatic skills and leadership.
So you were also central to the development of the public health instrument, the pandemic preparedness, influenza preparedness framework, as an instrument to detect and prepare and respond to pandemics. So how did you facilitate these kind of negotiations?
Well, you know, the Pandemic Influenza Preparedness Framework, or the PIP, as many of us will call it, was, I think, a major health diplomacy victory. And it's important to understand, why did this even come about? Because most people have never heard about it. But in essence, back, what was it, around 2006, 2007, I don't remember exactly, the Indonesian Minister of Health said that Indonesia would no longer provide H5N1 avian influenza samples to WHO, because she said it was unfair. Poor countries were providing specimens, but rich countries were making vaccines and medicines that poor countries could not afford. And so this led into an intense negotiation lasting 4 years. Poor countries saying sharing is a major issue. The global north was saying it's an issue if we don't keep getting these samples, because we need it for global warming, we need it for developing countermeasures. And so out of that difficult negotiations, the PIP framework was developed. And the reason why it was such a victory is because it finally recognized that sharing of viruses and sharing of some of the benefits like medicines and vaccines were co-equal. And in recognizing that, what it did was say that countries should continue to share viruses. However, countries making the vaccines and developing them should also share them with lower middle income countries. And it actually quantified how much should be provided, and it reached an agreement on that. So that kind of discussion about how do you balance these things, how do you make it into a real world agreement, is being used right now in terms of the global treaty, pandemic treaty discussions going on in Geneva right now. And so the role of WHO in that situation was really to facilitate the discussions. And so one of the things that someone like me did was speak with a lot of the representatives on both sides and work with them. How can we find solutions? How can we get past this challenge or that hurdle? So a very interesting process, very frustrating at times, but very gratifying at the end.
Do you think we can find align similar incentives for other public health challenges, like vaccine inequity and other like antimicrobial resistance, for example?
Well, I think that in terms of issues like vaccine inequity, it's a partial solution, but it's not a full solution, meaning that I do think that the principle that those that have, so richer countries, should share with poorer countries that don't have. I think that is a fundamental principle that we ought to have in place. But I think that if it's always one side giving to the other, it's not really a long-term solution. I think the long-term solution is we ought to think about how do we develop and produce these kinds of benefits around the world. It shouldn't be located in just a few countries, but it should be distributed more widely. This is a kind of structural solution to a long-standing problem. But I think that if we don't solve and address equity, we are always going to be doing much, much worse than we should be doing.
A little segue, but for my friends who are very ambitious and want to join WHO, how does one become the Director General of the WHO?
Well, not having been the Director General, I'm not quite sure. But I can tell you that, both for moving up in WHO, but also moving into WHO, for your friends that are thinking about, is it possible for me to get a job there? A couple of basics are really worth keeping in mind. Whatever you do, always ask yourself, what does an organization need? What is needed to actually do a good job? And I think part of the answer for that is that whatever you do, whatever skills you bring, you should be able to do them well. But I think also it is a real world organization. So you want to make sure that you can try to be involved with some of their activities, because then it makes you, more comfortable with what WHO actually does as an organization. But it also gives WHO a chance to see you. And so, for the Director General, basically that person has to be regarded by many countries in the world, because it's a vote which is taken at the end. So many countries in the world have to believe, okay, this person is up to the task, and this person is really going to do what the head of WHO should do, which is effectively help the global community come to solutions, come to answers. And so countries have to be convinced that a person can do that. And so it's a little bit the same as getting a job there in the organization. You got to help the organization be convinced that you can do the job. And then you got to make sure that the organization knows that you are around and want to work there.
So if I'm not wrong, the voting system is done in secret, and there's a lot of backroom deals done when one is voted up to the Director General position. Do you think that's fair?
Well, I think that the voting for any position involves a lot of advertising. You are trying to advertise yourself. Your supporters are trying to make the case for you. And a lot of that is not visible. It's like being elected president of a country. It's like being elected to any other position. And so I think that that is a large part of the real world of selecting a leader. So I do think that it's good to make as much of that process as transparent as possible. But I also fully believe that it's not possible to make everything transparent. I think that people have to be able to ask sensitive questions, and they have to be able to have the person give a direct answer to those things. And so I think that a lot of those things are, they're hard to do in front of the entire world. So is it the best process? It's the process we have, and I think it's still probably a fairly realistic process for coming up with director generals that can do a good job. We've had some very good director generals.
Margaret Chan, you talked about how she prevented a worldwide outbreak in pandemic. What happened there?
Well, in 1997 was the first time that we saw avian influenza appear in the world and infect people. The virus had been around for many, many years before that, but circulating just in wild birds. So it was in Hong Kong that it first started infecting people. And in 1997, there were 18 people that were infected. 6 of those died. So 1/3 of the people who got infected died. And many of these were young people. They were not elderly people with a lot of chronic illnesses, but really were much younger, and many of them were completely healthy. So this was a startling situation, and at that time really alarmed those of us working in the field. We had never seen anything like it before. So when we were doing the investigations there, one of the new pieces of information that came in was that many of the birds in the wet markets, in the open markets in Hong Kong, were infected by this virus. And we were thinking that this was how people were getting infected, that they were exposed to the open markets. And so the decision was made by the Department of Health and then the Secretary of Health that the chickens in Hong Kong should be culled. After that was done, and I remember the decision was made on I think it was a Sunday morning, and then by afternoon, the Department of Agriculture had started implementing it, getting ready to do the culling. But once that process started, there were no more cases. And so that immediate outbreak ended abruptly, and it was really due to the culling of the chickens.
So moving into your time at the School of Public Health, what were the major changes you made as the director?
Well, when I got to the School of Public Health, what I found was that Hong Kong and the students that I saw at this school, I thought the opportunities were fantastic. I mean, Hong Kong is one of my favorite cities in the world. I think of it as a very international city and a unique place in the world. And I also, in working directly with a lot of the students, thought, these are fantastic individuals. These people can move the world. One of the things which I wanted to do was to have the school become really rooted in the real world as much as possible, and not just in research, but really what are the issues going on in communities? What do things people care about? What do they need? And I also really wanted it to become increasingly global in scope. So instead of just learning different skills, which are important and which are foundational, statistics and epidemiology, I wanted the school to become focused on what are the biggest challenges globally, and then what's Hong Kong's role, and what is the role of the School of Public Health in helping to address them. And so that was my basic hope for the school. So we started a new undergraduate program, and it was really focused on getting students who are younger, so that it wasn't just teaching them skills, professional skills, but really teaching them concepts, trying to teach them the scope of what public health could be addressing. And so that was probably my basic contribution.
Do you think the clinical knowledge, skills that you got in medical school really helped inform you as an epidemiologist, as like a negotiator in public health, global health?
Oh, definitely. There is nothing like clinical medicine, which brings you face to face with people, the things that they're worried about, the things that really challenge them. When you're worried about your health, you can have very direct discussions with them. And those discussions that I had in my training and then in my early professional years really grounded me when I was working more on large populations, because large populations are really the accumulation of a lot of people who have real issues and so on. And clinical medicine made it very clear to me, what are people hoping for? What are they afraid about? And so for me, it was foundational.
So having worked in policymaking and academia, do you think the two fields are well connected?
I think they are complementary to each other, and complementary in this way. Academics at its best really focuses a group of people on answering questions and providing information, which is really critical. But if that information simply stays in articles or in academic discussions, it's nice, it's interesting, but it doesn't really move anything. Policymakers are part of a group of people that really set the directions for countries in the world one way or the other, and they're the ones who set the policies which are going to affect all of us. And so using the information coming from well-done studies from academic centers and using that to help inform the decision makers about what they ought to be considering. Decision makers, policy makers cannot only think about research information. They do have to think about what are the economic implications. Can things be done quickly, or is it going to take decades to do? There's a lot of considerations like that. But they really ought to know what is the best available information. And so I think academics and policymakers in the right relationship are essential to each other.
So moving on into your personal life, you were a Japanese in America during the 50s, growing up there. What was that like?
Well, I grew up in a small town in a rural area, and I don't know, I did a lot of the things that kids do in there. I caused trouble sometimes. We'd, throw snowballs at cars, would go fishing in the summer, did a lot of bicycling. So in many respects, living in a place like there taught me a lot of the values which I still have. Very much of a community sort of setting. The state I grew up in, Vermont, I think of as a state which has a lot of humanistic ideals, and I think that it's a very practical culture, and all of those things sort of affected me. We were also the only Asian family, or the only Japanese family in town, and I think also it wasn't until much later that I learned what it was like living in more Asian cultures, living in Hong Kong, for example. So, but growing up in a rural place in a Japanese family was a big reason why I wanted to see the bigger world, and so it sent me traveling to a lot of places as I got older.
So tell us about the gap years that you took when you were young.
Well, in keeping with that wanting to see the world, when I was in college, I took a year off because I wanted to see the world. And so I ended up spending some months in jobs to earn the money to travel, got a little bit of money from my parents, and then spent several months traveling around the world. And so most of it was done overland by cars or buses and trains and so on. And it's, I ended up going to Japan for a while, but it's the first time I saw Hong Kong in 1976. It's the first time I went to places like India, but it took me into places like Afghanistan and Pakistan and Iran. And it really completely changed my life. It changed what I wanted to do with my life. It opened my eyes up to what were some of the issues in the world. It was my introduction to poverty, really deep levels of poverty. And so when I came back from that trip, I was pretty different than before I left. And what I wanted to do became clearer to me. So it had a huge impact on me.
Do you think it's important for undergrads today to also take a gap year?
I think the way I would think about it is that it's now more important than ever for students to get out and see the real world. We live in a world which is dominated by computers, by social media, by electronic communications and so on. And they are all useful and valuable and exciting in certain ways, and also very different than the real world. The difference between actually going to a place and talking with people and seeing things with your eyes, your own eyes, is so much richer than any data set or any electronic communication you will ever have. You can smell things, you can feel things. So I think we are increasingly moving into an electronic age. You know, we can work from home. We don't need to see people that often. We can communicate by phones. But there's a downside to that. And the downside is that I believe that we are very much social beings. We depend on actually seeing people physically, spending time with them. So instead of thinking about it as a gap year per se, I would say, how do you maximize the ability to see the real world? And for many students, that will be taking a gap year. Not for every student, you know, not everyone can afford to do that. And there are a lot of other ways to do it. But I think the bigger issue is it's important to see the real world. It's important to let the real world affect you and change you.
So you well know about the enrichment year at HKU, which is where med students in their third year go abroad to do masters, to do research, do volunteering. Do you think, but for most part, actually, most students are still in an academic institution. Do you think that adequately emulates the sort of gap year that you had?
I think an enrichment year can be extremely valuable and formative. I think it depends on how you think about it and approach it. You know, the enrichment year is literally that. It is meant to be a time where you sort of take a year and help flesh out your education, your understanding, your ability to explore things. And I think if you do that, it can be very formative. It can be very helpful. I think it's a little bit different than the year that I took off. The year I took off was quite unstructured. You know, I took other years off which are more structured, but the first year was very unstructured other than seeing the world. And I didn't know what to expect from it. I didn't have any real goals other than to see the world. And so I think that if you can do that also, you know, it's a enriching thing.
Do you think that it might fail to capture the essence of what a gap year is because enrichment years are not, you know, inherently self-initiated, self-motivated. It's part of a curriculum.
I think it's not an issue of what the enrichment year is. I think the issue is how is the student going to think about using that year. So whether it's initiated by the school curriculum, you know, it's built into the third year, or whether it's initiated because the MBBS program requires it, is, you know, notable, but it's not the key issue for me. The key issue is that if the student sits back and says, okay, what do I really want to learn? What do I really want to get exposed to? Then they can take that year and get a huge amount out of it.
What advice would you give to year 1 and year 2 students who don't know like what to do? Like, you know, which country to pick, what to do, how to fill the year?
You mean in terms of the enrichment year?
Enrichment year.
I would say don't worry about it too much. You know, when we're young, including myself, I think I was particularly confused about virtually everything. Having clarity on everything is unimportant. I think that, but what you should push yourself about is not what country do I want to go to? Do I want to be in a program or not, or something else? I think it's to ask yourself a couple of more fundamental questions. I'm a young person. I have a year coming up. How do I really want to, what do I really want to sort of get exposed to? What do I really want to do? What's important to me? And so, again, I think it goes back to that very fundamental question of pushing yourself and saying, what's important to me?
So next is like a final list of just miscellaneous and quick fire questions. So what do you do now in retirement?
So I still struggle every day thinking, what am I going to do with my life? I look at emails and correspond with friends. I look at the news and get a little bit depressed. I practice my cello and get a little bit depressed. And then I frequently go for a run and then think, oh, you're really getting slow and achy. But those are the kinds of things I do. But the most important thing I probably do is my wife and I spend a lot of time together. We spend as much time with friends as possible. And, there are a lot of things that I sort of put aside when I was very busy working. I really see those as things that I want to spend more time with now.
When you were in your 40s, did you ever have a midlife crisis?
I think at various times in my life, I asked myself, what are you doing? Why are you doing it? And would have a lot of discussions with myself along the line. And so because of that, I think it was kind of like a safety release valve. And so I don't think I had a single crisis when I was 40. I think the habit of asking yourself every once in a while, what are you doing? Is this a good thing? Is it meaningful? Are you okay with it? It's a good habit to have.
If you could talk to yourself when you were younger, what would you say?
I think that if I was talking with the younger me, I would tell myself, don't be as hard on yourself as you are going to be. You can really make mistakes. You can do things that don't matter to you in the long run, but just because you want to do them, and that, enjoy those things which are really important. People in your life will move on, some will get older, and so on. These are precious things, and so notice those things more, and be kind to yourself.
What do your kids do now?
So I have two daughters. My youngest daughter lives in Los Angeles, and she works in the food business, making cakes, and she also is taking classes on landscape architecture. And my oldest daughter lives in Italy, and so she has recently finished a degree in urban planning and is starting a job. And, her goal is really to try to decrease cars in cities and increase public transportation and walking.
Was your parenting philosophy shared from your teaching philosophy with your work philosophy?
I think my parenting philosophy, which was shared by my wife, was probably simpler than my work philosophy. And it was simply make sure that your children know that they are loved and they are supported. And everything else will come out of that. And good things will come out of that. And so I don't think I purposefully sat down with my kids to say, I think you should do this or that, or you should be this way or that. I think my wife and I really thought we should set examples, but the most important thing we can do is to make sure that they feel that they are not alone and they are supported and we are with them. I think with teaching and work, there are more specific goals about what I wanted to do and what I wanted to accomplish, within the school or within work. But the kids, it was a little bit more simple and very fundamental.
So, final question. What are you most proud of?
Oh, most proud of us. Um, I think our family members are very close. We are very close with our daughters. We talk a lot together. Um, and I think of anything, by far, that is what I am most proud of.
Well, thank you very much, Professor, for your time. I just want to add that it's such a treat to have you here with us today. You've actually been someone that I really looked up to since high school, and it's such an honor to be able to talk to you about this. And having spent a little bit of time with you and your wife Holly, uh, it's incredible that you walk and you talk and you act with such a deep sense of humility, and that's a very rare thing. And as Holly said, like you take your work very seriously, and I think the world has been a much better place with you in it. So thank you very much for your time here with us today and sharing your story.
Thanks, Ivan.
Thank you.